today the agenda for the Internet of Education meeting is we're going to start with Kimberly Linson of RANDA Solutions, leading a discussion and a presentation on the COVID passports that RANDA Solutions has started as an implementation example of the kinds of technologies that will help build the Internet of Education. And then Duncan Cox and I are going to lead a discussion on how we might build the Internet of Education movement. So that's the plan today. Greg, if you want to ask for introductions of any new people that have come.
We just welcome Alex and Vitor. I don't know if there's anyone else who, Alex, do you want to just kind of introduce yourself to the group?
Sure. Let me just get the audio camera on. Everybody can hear and see me?
Yeah.
Awesome. Hey everybody, Alex Haber. I'm at Amazon Web Services and I lead our efforts in South Florida for K-12 education and state local government. So I work very closely with Broward County Public Schools, which is how I got to know Greg, and looking into things like digital wallet, comprehensive learner records, and a whole litany of other solutions and services to improve student and teacher and staff experience, and excited to learn with you guys.
Awesome. And Vitor, do you want to introduce yourself?
Sure thing. So this is Vitor. I work with the PathCheck Foundation, now leading a new initiative on building COVID health passports for vaccines and testing, mostly for the local business here in Cambridge, but with the idea to expand it, as best as we can. So very excited to hear what the COVID passport discussion will be like.
Awesome. I think Paul Buckley, you're new to this call. Welcome. You want to just introduce yourself?
Thank you. Certainly. My name is Paul Buckley. I run a one-person single shingle consulting firm called Proteo Orbis Ignis, which is Latin for all you academics. I'm sure you all know this. Is Latin for go forth and set the world on fire. I am a former colleague of Greg's, and I'm very interested in what's going on here in your group. In a former life, I was deeply involved in what I'll call old-fashioned contact tracing, which you might agree is a kind of a subset of the bigger issue you are addressing and perhaps trying to solve. And by old-fashioned, I mean old-fashioned, a lot of bodies, making a lot of calls and getting very little result. So I appreciate the invitation to join your group and learn more about what is probably the bigger and more important issue that you're about to discuss.
And we're not a group. You missed our opening where we're not a group. We're just a bunch of individuals coming here to share. Lucy, do you want to introduce yourself?
Yes, sure. Hi, everyone. My name is Lucy. I'm based in Toronto, Canada. This is my first time here. I'm one of the co-chairs of the COVID-19 Credentials Initiative. I'm sending a link there to our website. So we're a global community. We're not an organization. We're a self-organized, voluntary kind of community. It started off like in early April, late March, after the COVID, kind of like become like really serious in North America and in Europe, and our mission is supporting verifiable credential solutions for COVID-19, kind of solving COVID-19 problems and supporting those projects and bringing people together and sharing about what they're building and what the challenges they're encountering and how we can collaborate together on some of like the pre-standardization work and just sharing and like different local kind of experiences, and so that's what we're doing. And currently we're actually looking for kind of a legal home where we're gonna not necessarily turn it into an organization, but can keep advancing our work in a more kind of like a proper place, and also at the same time learning from other spaces, because we're more like in a public health space, and we want to learn from the education space where I know like you guys have been doing a lot of great work. So that's and also like someone is presenting on the COVID solution today, so that's why I'm here. I think my co-chair John Walker, he's also here.
John, do you want to say hi?
Sure. So as Lucy said, I'm co-chair with Lucy on the CCI initiative, basically working on the communications and coordination just within and across the community. I'm also doing some work in the Trust Over IP Foundation and DIF regarding basically the semantics, some of the data semantics, and how those data, the accuracy of the data payloads are delivered. So that's kind of my technical slant on this, but in general, I'm interested in, obviously in this space and understanding more about how there's a lot of learning that's required, and understanding more about how reaching out to different communities with information and learning how we can better address that. So looking forward to the conversation.
And just a 405 on the phone. You want to say who you are? Or maybe, is that Joshua? Are you dialed in as 405?
No.
Okay. Well, summon 405 637 if you want to say hi.
Hey guys, that's me. It's Cameron McCoy from Lehigh University.
Oh, Cameron. Hey, how are you? Cameron, did you introduce
I'm well.
yourself? I don't think you did, right?
I can really quick. Yeah, sure.
Please do, yeah.
My name's Cameron McCoy. I work at Lehigh University, building comprehensive relationships with outside parties, and we do quite a bit of work with blockchain-based digital credentials. Happy to be here. I'm just listening in because I'm helping my neighbor build his garage at the same time.
Yeah, no problem. Awesome. Welcome. Welcome, everyone.
Multitasking.
So, Kim, you're gonna take us through this first part, right? And we're gonna, what we've been talking about, Internet of Education. Actually, let me just do one quick segue, if I can.
Okay.
And then I'll hand it right over to you. Is that all right, Kim?
Yeah, I was just going to let you know, though, that the only person allowed to call me Kim is my mom. So unless you want me to start calling you Mom.
Kimberly, my apologies and thank you for the correction. Okay, so we've been talking here, primarily around the Internet of Education. And this is the logical model that we've been presenting, and we've been now, last week, we started to drill in to the component model. And so in the IEEE ILR recommended practices, we have been talking about this framework, and Simone, who's the chair, who's here, is going to be putting out. Do you want to just say something, Simone? Just quick advertisement about what you're going to be doing next on that.
Hello, everyone. You're talking about the survey?
Yeah.
Yeah, so we want to engage as much as possible the members or the participants. And so since we've been working and refining this conceptual model or this framework that you're seeing here, we're going to reach out and ask for feedback, clarification or contributions. We wanted to I guess do the work also when we're not meeting online. So if you're in the IEEE group, expect that hitting your inbox at some point soon. If you're not, reach out to me. I'll drop my email in the chat and we'll get you on the mailing list. Thank you.
So this digital wallet for learning, to me, is the same overall design as, I don't know what you want to call it, COVID passport or whatever it is you're going to call it. So that's the connection point here. And so Kimberly, if you want to kind of take us into, so RANDA is doing both the education credentials and the COVID credentials. Go ahead.
Yep. All right. I'll jump in. So here's where I want to start. I want to start with you all imagining that you are a 7th grade teacher right now, today. I don't know how many of you have kids and are experiencing that, but this is what it looks like. If you're a 7th grade teacher teaching English, you probably have Monday, Tuesday, you have half your kids showing up in the building. And then Wednesday is kind of maybe like a cleaning day and you get to work from home and catch up on paperwork, get prepared for the next. And then Thursday, Friday of the other half of your kids coming in the building. And you're trying to do all the same things you did last year, all the teaching you did, all the grading of papers, all the scaffolding and building and expertise that teachers bring to the table. You're trying to do all that in the midst of this COVID world. And every day you have to do a few things. And I want to show you what those things are. And hopefully, Greg, I should be able to share, right? All right, so you all should be looking at Holy Trinity Schools entry health questionnaire. And I actually put up my participant list just to see if, raise your hand if you're filling these out every day. Anybody who's, I fill 3 of these out on a regular basis because I have 3 kids in 3 different buildings. But this is for every person entering the campus. So the teachers are also filling this out. And you can see the kinds of questions. I mean, you're all familiar with these. I'm sure you've been asked. You know, who's coming in? What is their reason for entering the building? Well, who's your emergency contact? Well, geez, I'm a teacher. Aren't I my own emergency contact? But no, I got to give somebody. Has a person entering the building had, or a person in the household had any signs or symptoms of a fever in the past 24 hours? Well, I don't think so. I mean, I didn't take anybody's temperature, but let's go with no. And then this one is my favorite. Has the person entering the building or a household member displayed any of the following symptoms in the last 24 hours, not counting pre-existing conditions? Well, okay, let's see. I am awfully tired. So, but I think that my fatigue is explained. But yeah, okay, so I'm gonna go ahead and say none of the listed symptoms here. And in the past 14 days, has the person entering the building or household member tested positive or been diagnosed? No. This is the one that gets me too. In the past 14 days, has the person entering the building been to a state listed in the DC government's list of high risk? Why does the school need to know where I've been? I don't know that I really want them to have that information. I went, you know, we went to North Carolina. My kids didn't see anybody while we were there. We rented a house. We were totally safe. So I'm just going to go ahead and just like fib a little bit here and say that we didn't do that. In the last 14 days, has the person entering the building been exposed to anyone who has displayed symptoms? Well, I don't think so. No. All right. And here I'm complete the questionnaire and yeah. All right. Submit. So now I've been doing that while I went for got my morning coffee, and now I show up at the school building, and y'all have had this happen at a restaurant probably, right? So I have to check in as a teacher before I can go to my classroom and get started for the day. I got to check in, and they got to tell me whether or not 98.9, that seems okay. All right. So I've got all the data points here and all the data points and then all the temperature checks. And also my school is requiring that every 2 weeks, I go and get a COVID test. And I'll give you a little spoiler that I'm going to show you here, our COVID passport, and then we're going to talk about it in a minute. Oh, wait, where'd it go? There it is. All right. So here you can see, all right, I got an alert from the lab that I went to get my test results that the school is requiring. And so I'm going to click, this is a personal link that comes to me. So it's just my results, and I'm going to click this link. It worked super well when I tested it yesterday. Oh, there we go. All right, Linson. I do a lot of scrolling here. Oh boy, I'm positive. So I guess I'm not going to work today. So this is what this looks like. And I wanted to show you a positive version so that you could see the information and what's directed to the patient. Gives their information of what they need to do next. All right, so as an individual, I have just in the span of, what was that, 2 minutes, collected a lot of data about my identity, my COVID-related identity. All those questions I answered, my temperature, my COVID status. And this school that I'm the 7th grade teacher at, they've got about 300 students, 150 in the building at any point. So this is a really small school, and they've got a lot of the benefits of being a small school. But I want to show you what the principal sees, right? Because I don't know how many of you noticed, but that was just a Google form that they're using. So here's what it looks like to be the principal of this school, right? So I'm like, okay, wait, so what am I doing? Am I just looking for a yes? Am I, okay, there's all those no's and people's emergency contacts. It's a lot of data that they're needing to, and let's be clear, it's probably not the principal, right? It's probably someone on the administrative staff who's been assigned to go through this and try to sort out, oh wait, there's a yes. What does that yes mean? They visited North Carolina and they said yes. Can they come in the building or can they not? How do I know? What are the rules here? So I appreciate your indulgence here as we talk about sort of what I think is the biggest problem here. And that is, or at least the place we need to figure out how to get to. And I'm really hoping that this group can help us figure this out. Right? All those data points, I know there is the technology available to us to be able to figure out how all of these credentials can be compiled into one place with business rules where we can then deliver to the school all they want to know, right? Isn't this all they want to know? Is this person coming in the building low risk? Are they high risk? Are they in between? And then I know what to do, right? Schools should be educating our kids, and this should be something that they don't have to think about or worry about. So let me just tell you a little bit about how RANDA got started in COVID reporting. We've had a long history in healthcare, but you all know that our primary passion and focus is around education and especially around educators. But as often happens when there is a crisis, we all pitch in. And we have a colleague in Nashville who came to us. He owns a lab where they were doing COVID testing, results testing. They were taking in specimens and doing the analysis on those specimens. And what was happening was they were having a roadblock, right? They were focused on taking in those specimens and analyzing them. And then they had the results, but the results had to be communicated out. And that was taking lab personnel who have the expertise and talent to be able to be doing the diagnostic work. Now they're sending literally faxes, sending mail, and trying to get these results communicated. First of all, that took too long and it was taking too much of the lab personnel time. So they came to us and said, hey, can you solve this? Can you help figure this out? And so the system that we built, this is, I think we all are here that this is changing very, very quickly. I think that's why it's hard to sort of get your arm, and why I wanted to start with really what I think the problem is, because I think we need to try to get our arms around it as standard organizations are being, are coming on board. Like, let's really focus on the problem. And the problem really is that results sharing is largely self-reported, right? Like, I'm the one now who's going to call my school and tell them that I had a positive test. I'm going to self-report that. And so how can we solve that? All right, here's the solution that you saw me use. It collects very minimal patient data, the patient's name and date of birth. We're able to turn the results around in less than 24 hours. We do send faxes and mail still to the Department of Health and some physicians' offices who request that. But from the individual, you're able to then just have an email and text delivery system where that you saw that unique link came to my phone. And when I clicked on it, I was able to log in and see my results. Very simple, very quick. And it's absolutely scalable. We can do this with the 1,000 people that are being tested now to tens of thousands. And then where we're wanting this to be is to have that result available as a verifiable credential, which means that the added step would be that once I've logged in and seen my results, I can choose to add that to a passport. Just to toot our own horn for just a second, this solution was approved by the Department of Health in less than a week. And more importantly, what we're hearing from the customer is that the staff is focused on the right thing. They're focused on getting as many tests processed as possible. And they actually are finding the system to be very user-friendly as well. Here it is, just to give you the flow. Right? Department of Health, the counties, doctors' offices, medical groups, they're all getting those specimens to, collected and then dispersing them to labs who can do the diagnostic work. I think one of the interesting things here is that the lab management, information management system, this is not, they don't have to do anything to get us the results. We actually have built a solution that goes in and collects this data and then disperses it as necessary. So if it needs to get faxed to the Department of Health, that's where it goes. And then it goes into that portal that you saw for on cell phones. All right, so this is where we started. It was taking 10 days via paper back in April. And now we're at 24 hours with text. That verifiable credential, we're going to go ahead and launch that in January. And then I think this is where we're really, the problem that I addressed at the beginning is where we want to be by spring is able to deliver that verifiable credential with zero knowledge proof so that we're able to help schools do that thinking, get people in the building without all this data floating around that isn't necessary. And then hopefully we'll be able to do that. Hopefully a vaccine will be out by June, and we'll be able to do this same thing, including that vaccine proof. So here is, here's back to that original problem slide. And so what I have in these next few slides, and I can actually come off the slides, and so we can just talk, is really some questions that we've been thinking about, and I thought this group would be really helpful to hear and discuss together is what needs to happen to get from this app that I've showed you where I get a result and I can see it on my phone and I can even turn it into a verifiable credential, but it lives on in my phone, on my wallet, to actually this place where schools are able to use that data to make decisions. So I think what needs to happen? What kind of business rules are schools going to need to develop? And I think that's the thing that I wanted to. I've been in education and in schools for a really long time, and one of the things that I know is that if schools are left with this problem, they will solve it for themselves. They will say, okay, well, here are our rules. You go to North Carolina, that's fine, but you have someone in your house who tested positive, not fine. They'll make up these rules. The problem will be that we will have a different set of rules in every district, in every school across the country. And I think that they don't want to do it. They don't want to come up with these rules. They don't want to come up with this solution. But if in the absence of one, they will. So how can we, I really see potentially the Internet of Education being an organization who has this trust and can potentially do that for them. And then I think, this is an ecosystem question, right? You've got labs, you've got Department of Health, you've got, now I'm bringing schools and education into the mix. What ecosystem is necessary? How do we build a proof of concept that's scalable to a school where every person entering that school building has the same thing? And how do we do it? How do we do the thing? And who is going to do the thing, I think, is the last thing I'll leave, and then hopefully we can have a bit of a discussion around those questions. But I wanted to leave you with this. Who's going to do the thing? Well, I'll tell you one group that's going to do the thing, and that's RANDA. And I don't know how many of you know how the name RANDA came about, but I love this story, so I'm going to tell it. And that is that the name RANDA stands for Read, as in Marty Reed, and anyone who will help. So that's in our name. And so we're ready to go, and we're gonna get this thing off the ground, but we'll take whatever help we can get. So that's I'm gonna stop the share, and hopefully we can have a little discussion around some of those questions.
Really, that was fantastic. I want to time box the next part of this of questions about this for 10 minutes, because I want to make sure that we have 20 minutes for the second item, if that's okay. And I want to particularly highlight Tracy and Dan, who lead communities who are dealing with these issues. Many of the rest of us are providers, but I think it's particularly important to hear from Tracy and Dan about, does this fit in North Dakota? Does this fit in Broward County Public Schools? Do you see implementing this type of solution this spring? Or not, or what questions are? I think it'd be good for you to start with you guys. Is that okay, Tracy? Do you want to start?
Yeah, I mean, it sounds really good in practice. I understand what you just described, Kimberly. It was really good. But holistically, how do you bring together the survey as well as the test results, as well as other circumstances to bring forward zero knowledge proof? And then technically, how are we implementing the reading of zero knowledge proof as they walk in the schoolroom? I can guarantee you that school administrator looking at that spreadsheet, they're not getting done with that list until noon. So they've had a high risk student sitting in their class, for 4 hours already. So that's the interesting challenge, is how do you bring together the different types of survey and holistically bring it into one thing?
Maybe flip it around, Tracy, the other way, because I think, what do you see as blockers? Right? What would make this? I mean, because the answer, I think Kimberly's answer is going to be like, well, we're just going to roll up our sleeves and we're going to keep on working on it until we have a solution. We're going to iterate on it, and we'll get over the first little bumps and then the bigger bumps, and then we'll go. But do you see blockers? Do you see roadblocks? Reasons why this can't work?
No, I don't see reasons why it can't work, especially with this community. I think technology is always in play here. How many people have got smart devices that they're going to be carrying into the school, in 7th grade, 6th grade, 7th grade, because I'm assuming we're talking about publishing a verifiable credential. Sounds like you guys are working on a web app, which would probably help things out quite a bit. It could happen, but it's just going to take a commitment by a state to implement all those features.
So Dan Gold, are you with us, Dan?
Yeah, I'm here. So first of all, great presentation. Thank you. And yes, very deployable if the concept is able to be executed, right? So we here in Florida happen to have the boundaries of our county public health match the county definition of school district. And the coordination of the public health services in providing information to schools should be made easier. But contact tracing has shown us that it is of questionable quality. Schools are continuing to do their own informal contact tracing, even while the county's supposed to be doing it. The active sharing of information would be tremendous. And if both at the individual student level, as well as in some kind of dashboard, these were to be actively notified as changes in status occurred, I think that overcomes the burden of having to scroll through everyone's data. Yeah, I'd love to deploy it. My only request would be, can we include field data on vaccination? Because that's going to become a slow rollout beginning at some point in the spring and continue for 6 months or more. And so it's both testing status and vaccination status, which is going to give us a holistic view of what the risk factor of individuals is.
And Dan, I have this picture of a principal at the door being like, you know, for each kid, wait a second, I'm scrolling. Well, let me see your vaccine. Okay, now let me see. No, wait, you're right. And like 300 kids trying to get through the door. And like, I mean, it just.
And is it also then still like you've been vaccinated, but someone in your house has it? So are you higher risk than someone who's been vaccinated but has never had it? Like there's so many variables that have to be defined.
So
yeah, it's the carrier question. Can you be vaccinated and still be a vector?
Right.
I want to bring Lucy and John in, and I don't know, Richard, whether I'm not sure, Richard, who you are, but if you're, but you guys are working on this problem, right? You guys have been working on this problem, Lucy and John, right? And other people around the world are working on this problem. Can you just kind of talk a little bit about the state of this? Where are there places we can see reference implementations where verifiable credentials are used for COVID test results successfully?
Yeah, I can share a little bit. So like, I think that the context here with the COVID-19 Credentials Initiative, we're more like a community of grassroots kind of solutions. It's like, we're not talking about Microsoft, one of those big players. They came and present, but less of a participating. So like, if I can share a list, like after I talk, what the projects have been presented at CCI. I think there are already over like 30 projects presented and already are going to present. So give you an idea globally, what are those kind of a grassroots kind of like solutions. And I think and also there are some solutions again are more advanced in terms of like how they're dealing with government and how they're doing local implementations. But still, like I like I said, because we're not kind of like in close touch with the big players, I think they're definitely doing something like very different from what we're kind of focusing on at CCI. And I think one thing just to what Kimberly just presented, I have a few kind of comments or questions. So when you're talking about business rules, my understanding is you're mainly talking about how schools, there's pretty much an algorithm, right? Like you have to define, low risk, medium risk, and high risk. And I think that's one part. A lot of conversations we had at CCI is around more kind of a broader governance, right? When you're talking about, like testing labs, because I saw like not necessarily verifiable credential solutions, but also like other similar kind of passport credentialing solutions for COVID, for how you're gonna know which labs are legit, right? Are you gonna have a list of those labs so that schools kind of recognize where even like, at the government level, they recognize these labs are legit, so they can actually, you can actually have to go to those labs so to get results. Otherwise, you won't be qualified, for your solution. That's one thing. Another thing is we talk a lot about at CCS, like verify the verifiers. Who at the school who are able to, I think probably this is less of an issue probably in your situation, but like broadly we talk about why Lucy, if I go somewhere, why should I trust someone just come and just scan my QR code and want to know if I'm COVID positive or negative or not, right? Like how are we going to do that kind of like kind of management? It's more like high level, like governance. I believe like you guys are also part of Trust Over IP. I think that's where a lot of those conversations are happening. And CCI, we have a task force. Our governance work stream are part of Trust Over IP. They just come up with like a governance framework version 2, which I'm going to share a link to, so folks can kind of get a better idea what kind of things we're working on. So the idea there is like we're not having like a kind of a very low level. It's more like a higher level when you're talking about COVID COVID credentials, what are like the governance kind of like questions you need to ask? What are the principles? Like at least we believe, or the community believe, are important. And as the next step, what we want to do is we want to kind of zero in on one kind of type of credential, like very likely vaccine, and so that we can build kind of more specific kind of governance kind of a framework around it. So that's where we're at. And in terms of globally, I haven't seen, at least, because we're like, the challenges are getting kind of in touch with public health professionals, with government officials, not only us, because I'm also in touch with Linux Foundation Public Health. So they're backed by the big players, right? They're Linux Foundation. Even them, it's hard for them to get into conversation with like the decision makers, because they're just so busy managing like other more higher priority stuff. And also I think it's because this is new, and also kind of like risk. It's kind of like a higher risk for them, right? And one of like the conversations I'm aware of, like the New York City, they're kind of in search of some kind of solution to reopen the city, and what they're looking for is like established players who, not necessarily in the public health or healthcare space, but whoever have been doing some kind of similar, credential, not verifiable credential, just like credentialing solutions that can be used. Sorry, I'm done.
No, this is my new visual cue I'm gonna start using. I just want to give John a quick chance to say something if you wanted to add to that, and then we're gonna go on to the second item. And clearly there's interest in this. Vitor, I see we should have a separate working meeting on this, right? This deserves definitely anyone who's interested coming together, and we'll do a working meeting on this, right? And so, Kimberly, do you want to be the point person for that convening, or would you like me to?
Sure. Well, you and I can touch base.
Well, so why don't people, Kimberly, why don't you put your email into the chat?
Sure.
And you're willing to collect that, and then I'm happy to work with you to convene it. John, do you want to say something before we move?
Yeah, the only thing I would comment on is clearly at least in the, showing the collection of the information at the school level. I think we're alignment with the Department of Health in whatever jurisdiction, right, is actually responsible for the collection of that information, as well as the validation of lists of valid tests. That coordination needs to take place, and I think it's good to think about kind of the trust triangle, or the trust model that's in the trust over IP. Now, who is the trusted issuer for these credentials, including, again, alignment with different jurisdictions and responsibility roles is key there. Although you could do it just, peer-to-peer, but it doesn't really seem like the model you guys are discussing. But there's a lot of drill down to be had there. So those are two comments, I think.
Awesome. Working group. Richard, did you want to get in on something before we go?
Sure, just very, very quickly. So to introduce myself, I'm a neuroscientist by training at the University of Miami Miller School of Medicine. I run something called the U-Health Care Lab, which sort of operates at the intersection of science and policy. And I've been working on COVID-related things since April. I guess the one point I wanted to make here, Greg, was I just really see the focus at county, state, and federal level swinging very substantially towards the vaccine, and the issue of coming together on test credentials. It's not unimportant, but I think the public health personnel from local to federal are really now just swinging their attention, and credentials and certificates and passports is just like way down the list, right? I mean, I spoke this week, just for an example, with the director of the Medicaid program for the state of Florida, and with 4 million beneficiaries, 4 million Medicaid people in Florida. She has no idea today how she would track whether or not Medicaid beneficiaries have been vaccinated.
Yep.
Zero idea, right? Mm-hmm. I mean, because the data structures issued by CDC don't have a data element for insurance carrier. Wow. And so there are and so then when I sort of say to her, hey, what about credentials? She's saying, Richard, you gotta be kidding. That's like way down the list. So I'll pause there.
Well, let's just segue it from there of to me, the common factor of this is personal data control. It's why I went to PathCheck in the first place and spent a few months there. For me, it's the common factor, which is if we create a world in which we have personal data control, then things change, right? And so I want to segue over to Duncan to talk about these principles, right? Because we're trying to do this. Yes, we're trying to do this for education, but we're trying to do this for health and for finance and everything else. Someday we want to be as cool as Estonia, and actually handle, private data appropriately, right? And get rid of the surveillance capitalism and into something that is really appropriate for this next century. So Duncan, do you want to talk about these principles and where we're at with them? And then Rob about the movement?
Sure, yeah. Thanks, Greg. Yeah, so for those of you who don't know me, Duncan Cox with Learning Economy Foundation here. We, along with folks in this call and then others scattered throughout the world, have been working to develop the Internet of Education guiding principles. And I'll share my screen just for ease of presentation here. Everyone can see that okay?
Yep.
Cool. So we, along with a lot of different folks, set up a community for the Internet of Education to discuss these guiding principles. And after, lots of debate and discussion, we landed on a version 1. So understand that these principles are not final. They are just in their present state. As I scroll down this list of principles, the website is internetofeducation.org, which actually I should post in the chat for those of you who are interested. Here. Well, can someone else do that? I'm not sure how to post it.
I got it.
Thanks, Greg.
I got it.
So, we've got this list of principles. And the foundation of these principles is that they're a shared understanding that we can all have and that anyone can pledge their support to in order to support the broader movement towards this an open internet of education that helps provide quality education and work experiences to folks throughout the world. We've already had conversations on this call about the principles themselves, so I'll just briefly scroll down. But if you want to weigh in on the principles, if you have any questions or concerns or suggestions about how they could be laid out, please click this little chat bubble and it'll take you to the Internet of Education community where you can weigh in on the principles. And then as we have further discussions and iterations, we can continue to, refine them and make them really suit the needs of all the education stakeholders and beyond in the world who could be using this type of framework. Now, after reading the principles, I would really encourage anyone who's interested to, if you scroll up to the top here, you can pledge your support to the principles, and there's a couple of different spots that you can do that as well. We sent out an email and we kind of launched the Internet of Education principles yesterday. And so folks, if you're interested, please pledge your support as either an individual or an organization. And what we'll do is we'll take all the folks who have, expressed interest and we'll begin to gather them and to poll them and to kind of do a coordinated push to work together to, enact these principles throughout the world and build all of our various work efforts with these principles in mind. So yeah, it's just a quick little Google form. If you don't want us to email you, we don't have to, but it'll take 5 minutes for you to sign it out. And I think one of the great ways that you can support this movement is after signing the principles, either listing our logo on your website or, even just putting signatory Internet of Education guiding principles can show to the rest of the world that you have bought into these principles and that you're willing to support these ideas and collectively push together forward with us. So that's all I have. I don't want to take up too much time, but anyone have any questions about the principles or next steps regarding them?
I have the question, do we have time to link to that in the chat right now and have people who want to sign up right now?
Sure, yeah. I can,
So the link's in there. You can just go to internetofeducation.org and you can
link directly to that signatory thing then.
Yeah, Duncan, if you can put that direct link in.
Yeah, sure.
Awesome.
If I could, Greg and Duncan, just a question for you. Education has many distinctions from the public health space, and I'm not sure that all those principles will ever apply in the public health space. And what we're talking about today is at the intersection of those two. You know, the presence of the state, whether it's, you know, in the abstract sense of the word state, in public health, I think is, you know, conceivably one of the raison d'etre for a state to even exist is to look after the public health for the whole population. So I don't know if there might ultimately be some tension there between those principles, Duncan, and particularly the weak center. And when it comes to matters of public health. So I just share that thought with all of you.
Yeah, no, that is a really good point to bring up. You know, as we develop these principles, we wanted, I mean, we're obviously very specifically looking through the lens of education, but it would be a mistake to not consider the needs of other sectors that from a technological perspective could often benefit from the types of credentialing or the types of data infrastructures that an internet of education could use. So I'm not sure the best approach to, you know, try and integrate the needs of the public health sector in the internet of education. So does anyone have any thoughts on that?
Well, I mean, I only have a suggestion for an area of investigation, not resolution. And that is, you know, childhood immunization programs, right? Those are essential for schools and for child health. And you know, the CDC has 63 or 64 different jurisdictions, and those jurisdictions are required to have a childhood immunization program, and schools must see evidence, you know, proof of vaccination or, you know, an authorized exception. So that area is one in which one could investigate quite directly the intersection between education and public health.
Yeah, that is a good suggestion.
Duncan, I have another comment. I guess it's maybe slightly off topic maybe, but I think it's really related here because I think as we at BYU were looking at credentials, especially in kind of in that whole market space with IIW, Internet of Identity Workshop, forgive me. So, and identity in terms of how does the credential that we have, that we personally are holding in our wallet connect to the entity that's at the school? And also if the schools can have a way to connect to that wallet and create an identity that's within the SSI framework, then the school can say, I can at any time request that data from the individual about the COVID credential or health credential, whatever credential that they want really, and do a business process on it. But also if the school can also issue a credential that says this is a recognized individual for our school, that kind of bootstraps an identity framework and an identity credential throughout an ecosystem, right? You need that internet of trust with that school issuing that type of a credential. But I think there's a collaboration between, once I can associate a credential that represents the individual for the educational institution and the health credential that I'm getting, and we can create that strong association. Now I can use both those credentials to share the data where needed, and I know and trust that it's that individual, but I can also tie the individual into my educational system. And I can at any time with the person releasing the data, obviously through the wallet, do the process. So I could say, before you come to school, ask what's your status on your credential before you even come, and real time through the infrastructure and wallet, know whether you should even come to school based on your status.
So a similar framework to like how immunizations are now. That would be interesting. Do you not see that kind of idea represented in the principles? We do have in Principle 9, just the agency and access control is maybe a little broad, but.
So I want to just shift this though, because I want to leave a little time for Rob to talk more about kind of these next steps, because we've got, you know, hundreds of people involved, but we want tens of thousands of people involved with this, right? This is fundamentally about how human development is going to be in the next century, right? Is it going to be owned by Facebook, or is it going to be owned by each one of us, right? And the Internet of Education is all about it being owned by each one of us. Our data owned by us, controlled by us, right? So Rob, do you want to just talk about that?
Absolutely. So what I've done is I've created a little Slido event for us to participate in. If you all would click on the link in chat and go there, then we can blaze through this. I think it's just important, like I can show you the different channels that we have for building the movement in terms of communications and networking, but it's important to look back at kind of why. So, and then also how we want to work. So I think this is maybe useful. Let's pop over to the movement. Can you guys all see the poll here?
Yep.
Okay, great. So if you follow that link, we can kind of collaboratively throw up a couple of ideas. And the first question really is like, why are we calling this a movement? Why is it important that it's a movement instead of like a standards body or a company or a group of companies or something? Why a movement? We need to understand what's motivating us before we can, yeah, okay. And I'm going to participate too. So it's because it's a public good, because it requires lots of folks, a paradigm shift. I think also because we wanted to work across, exactly, we wanted to work across competition, across any competitive barriers. That's part of it, right? There will be a lot of different companies crowding into this space and already are. And the crucial thing is that they be able to interoperate in order for this to work, right? So here's another question. How do we want to do this? Now, when I say how, I don't mean like on Facebook or on YouTube or, but really like, what's the, you know, inclusively or by making useful things that people want. The way that we execute across the different channels that we use, I guess, is a question I have. I think leveraging self-interest maybe is another how. By involving learners directly. This is something that's come up quite a lot. Getting value into the hands. Now, so does anybody want to say more about that? Yeah, getting value into the hands. So here.
Yeah, it was truncated, but it was into the hands of people. So
great.
If it's something that's usable, then people are going to adopt it.
All right, so would you all just mark which communications and networking channels you use? This is where we are right now. We're now on Twitter, on LinkedIn, on Facebook, on Twitch, on YouTube. Of course, everybody uses email. So if you could all just mark which channels you use. Great. Not a lot of Twitch users here. But apparently this is one way to reach the youth culture. So this is something that we wanted to bring up because there are places where using Twitch and Discord, we're actually having a lot of breakthrough connections with students. And when I created the Internet of Education channel on Twitch, I saw that there was a tremendous amount of education actually happening on Twitch. Okay. All right, so the last thing I wanted to do is ask you to actually take some action. It's a call to action here. This is a quiz. I'm going to stop that poll. I'm going to share this quiz. Okay, so I'm not quite, let's see, can you all see this right here? This quiz, were you able to get
the quiz?
Share the link, I think. Let's see. Okay, good, yes, we've got it. Okay, so here's my question. Will you help grow the movement by spreading 2 memes a week for the next 3 weeks? Here's the plan. I'm creating short shareable videos and blog posts that go through the principles and the main concepts inside of the Internet of Education as we've devised it. And so my request is to everybody here, would you go into your channels and share 2 memes a week? And by meme, I just mean one of these pieces of content. Or if you don't like the piece of content that I create and provide, then something inside of the idea cloud that we're working with here, would you do that twice a week for the next 3 weeks? So far we've got 100% participation, but only one person who has participated. So maybe just say aye or raise your hand if I haven't successfully shared this poll. Who did get on here, by the way?
It was me.
Okay, how did you do it, buddy?
I just clicked on the thing.
Oh, you clicked on the thing. Where's the thing? Click on there.
How do I do everything? I click on the thing.
Here it is. Okay.
Oh, here we are.
That's all I know how to do anywhere is click on the thing.
Click on the thing. Excellent. Can we get another participant?
I thought I clicked on the
Mine
thing.
says voting is closed.
Yeah,
Likewise.
mine.
Aha. Okay. So I failed at getting the vote in, but can people just paste into chat? Okay, just paste into chat. Yes, I'll spread 2 memes, or yeah, I'll do it. What I'm looking for is for you to kind of sign on the dotted line that you're going to spread 2 memes a week for the next 3 weeks. That's all, inside of our concepts and what we're doing. Okay.
So here's what I'm going to do, which is this is outstanding, Rob. And
yeah.
As you know, we've got about 200 people on one email list and 170 on the IEEE ILR thing. So we'll push these out to the the 300-400 people.
But don't quit yet, because there's one last question I want to ask, and that is, will you bring 3 relevant guests to this meeting on December 10th and paste that into the channel? This is crucial. If we're building a movement, we need to have more people in here. Okay, so paste it into chat. I failed at the quiz on the thing. Forgive me, but this is the most important thing, that we have more people come to this meeting. And Greg,
and Tim's asking the question. So obviously Thanksgiving, U.S. Thanksgiving next week, so no meeting. The week after that, we'll be back at Conceptual Model for Learning Technology Standards, IEEE. Week after that will be ILR recommended practices again. And then on the 17th, we'll have open topics again.
17th, okay. So bring 3 guests. Will each person here bring 3 guests on December 17th? That's the request.
Yeah.
And if you would paste your response into chat, sign on, make a plan, and we'll be in touch.
Awesome.
That's how we build the movement, folks.
Great work, everyone. Okay, we'll talk to you all soon. Thank you, everyone. Thank you, Rob. Thank you, Duncan, Kimberly, everyone. Good to see you all. Richard, nice to meet you.
Take care.